You are watching Medicine with Dr. Moran. I'm Dr. Keith Moran. Today I would like to review things that patients can do to prevent atrial fibrillation. Many of my patients have intermittent episodes of atrial fibrillation. This is the most common heart rhythm abnormality. Several years ago, when medical evidence became available to support lifestyle changes to reduce the frequency of atrial fibrillation, I created a patient information sheet, which I have been giving out to my patients with atrial fibrillation. I manage a large number of patients with this condition. I wanted to share these recommendations in a video format today. We call this paroxysmal atrial fibrillation. The word paroxysmal means intermittent. As I mentioned, this is the most common heart rhythm disorder. Fibrillation can come and go, so patients can be in normal rhythm, then go into fibrillation and come back out of it. As people get older, it increases in prevalence. Looking at the slide, you can see only 1 in 1,000 will have this before the age of 55. As patients age, the prevalence increases significantly. When you look at people over 80, it's present in 20% of people. Symptoms of atrial fibrillation. These can be quite varied, as you can see. Some patients are asymptomatic when they go into atrial fibrillation, and they do not notice it at all. This tends to occur in older patients. Most younger patients will have symptoms and can often note the onset of atrial fibrillation as well as the offset. The most common symptom tends to be palpitations. Patients feel their heart racing or going quite irregularly. That's what palpitations means. It's often more noticeable when they're lying in bed and not moving. It is at this time patients can feel the heart beating inside their chest. Atrial fibrillation can be rapid, but it can also be of normal speed if patients are on medications or if they have slowing of some of their electrical fibers. Other associated symptoms can include feeling lightheaded or dizzy. Patients may notice shortness of breath if they're doing an activity and the heart rate is very rapid. Lifestyle and risk factor modification is very important in the management of this condition. Adherence to these recommendations can markedly reduce the frequency of atrial fibrillation episodes. Often these lifestyle changes, which can easily be accomplished, can be better than taking a rhythm drug to prevent atrial fibrillation. Rhythm drugs are called antiarrhythmics. All antiarrhythmics have side effects, and it's obviously better to make lifestyle modifications rather than to take rhythm drugs. There have been many studies which show that the following lifestyle changes will reduce the frequency of attacks of atrial fibrillation. Unfortunately, it will not prevent every episode of atrial fibrillation. This slide has all the lifestyle recommendations that are helpful at reducing frequency of atrial fibrillation. These include achieving a normal weight if you're overweight, regular physical exercise, treatment of sleep apnea if it's present, optimization of your cholesterol values, normalizing your blood pressure if it's elevated, reducing your salt intake, achieving optimal blood glucose control, avoiding stimulants, reducing emotional stress or anxiety, treating any underlying structural heart disease, as well as quitting smoking. In the next few slides, I will review each recommendation one at a time. Weight management. You need to achieve a normal body weight, which can be measured as the body mass index. A normal body mass index, or BMI, should be 18.5 to 25. The BMI is computed by taking your weight in kilograms and dividing by your height in meters squared. There are many body mass index calculators online for you to compute your BMI. Everyone should know their BMI. There are many animal experiments demonstrating that increasing weight correlates with more atrial fibrillation episodes as well as longer duration of episodes of atrial fibrillation. Weight loss surgery, otherwise known as bariatric surgery, produces benefits in atrial fibrillation reduction. A Swedish study of 2,000 patients who underwent weight loss surgery were matched to a similar number of obese control subjects, and the risk of new atrial fibrillation was 29% lower in the surgery group. In the Legacy trial, with patients who lost and maintained more than 10% of their body weight, they had a 6-fold reduction in atrial fibrillation compared to those who lost less than 3% of weight. I should mention that patients with a very low body weight, such as a BMI of less than 18.5, in other words, they're underweight, those patients in fact have a higher likelihood of atrial fibrillation. Regular physical exercise. This is very important. Achieving 10,000 steps per day, if you have a fitness tracker or phone that can monitor this, is one way to document your regular exercise. Other ways you can think of this is trying to achieve 3.5 to 5 hours of moderate intensity exercise each week. Moderate intensity is similar to brisk walking. It would include chores such as pushing the lawnmower, bringing wood in, snow shoveling, etc. Regular exercise has been shown in the CardioFit study to reduce atrial fibrillation burden. Even mild improvement in exercise capacity are associated with a 2-fold greater freedom from atrial fibrillation. Other types of exercise can also be helpful. In the 3-month Yoga My Heart study, there was reduced atrial fibrillation burden symptoms, as well as improvement in several domains of quality of life. So mind-body exercises such as yoga or Tai Chi, as well as other exercises such as balance training and muscle strengthening, can also be helpful. Obstructive sleep apnea is present in many patients with atrial fibrillation. Let me explain obstructive sleep apnea to you. This is caused when the breathing passageway in the back of the throat is narrowed during sleep. Snoring occurs with mild or moderate narrowing, but when the passageway becomes more significantly narrowed, patients will stop breathing or will start to gasp to get air. It's difficult getting air through a nearly occluded airway. Ultimately, if the airway is completely occluded, they will stop breathing, which we call apnea. In order for them to open up their airway, they have to shift from a deeper level of sleep to a much lighter level of sleep so that the muscles that control the airway will then open the airway. This produces a type of sleep awakening which patients will usually not remember. Ultimately, as they drift back into a deeper phase of sleep again after the episode of apnea, the airway occlusion occurs once again. This process can occur many times during the night, and so many patients with obstructive sleep apnea wake up in the morning feeling very unrefreshed. And they feel that way because of the multiple sleep awakenings that they are not aware of. They have not achieved the prolonged periods of deep sleep that their body needs to get through the night. And memories that are formed during these phases of sleep will not be as deeply ingrained. Obstructive sleep apnea is very common in obese individuals. Medical evidence in observational studies suggests a clear relationship between the severity of sleep apnea and episodes of atrial fibrillation. Treatment of sleep apnea will reduce the episodes of atrial fibrillation. All patients with atrial fibrillation should have a sleep test to either rule the diagnosis out or to make a diagnosis of obstructive sleep apnea. Treatment of obstructive sleep apnea will reduce episodes of atrial fibrillation. A CPAP mask is the treatment. This provides continuous positive airway pressure through the nose down into the breathing passageway to splint the airway open through the night. Depending upon the severity, we use different amounts of positive pressure. It is important to get 7 or 8 hours of quality sleep each night for your health. I recommend a consistent bedtime and wake-up time every day, including the weekend days. Cholesterol values. These should be measured. The targets for the LDL cholesterol is less than 2.5 in metric units or less than 100 in the imperial units. Your triglyceride level should be normal. If you're above these values, you will need to be treated ideally with diet first, but if this is not successful, a trial of medications. Blood pressure. High blood pressure is associated with developing atrial fibrillation. This should be measured at home. I recommend to my patients purchasing a home blood pressure monitor if you have high blood pressure. It's important to periodically check the value that you get with your monitor at the same time as when your doctor or pharmacist checks their machine. When you compare both readings, they ideally should be within 5 or 10 points. An ideal blood pressure should be less than 130/80. Ideally, patients should take 3 readings when they are taking them at home, 5 minutes apart, and average the last 2 readings. Proper technique is important. I tell my patients that usually there's a certain amount of variability in their daily readings of even up to 15 to 20%. Keeping a diary of your blood pressure numbers is very helpful. A list of numbers from the morning, afternoon, and evening can sometimes show you how the blood pressure varies during the day, and this allows us to change the timing of blood pressure medications to smooth out any times where the blood pressure is quite high. If you are on several blood pressure medications, it can be helpful to make sure that at least one medication is taken in the evening, so that it prevents the rise in blood pressure which occurs in the early morning hours just before you wake up. Taking medications at this time in the evening has been shown in several medical studies to be of benefit. If your blood pressure is above 130/80, dietary interventions are tried first, followed by medications. Here's your joke for the day. This is from Unger, Herman Cartoons. It's showing you how not to take your pulse and blood pressure. Salt intake. I recommend keeping salt intake below 3,000 milligrams per day. It can be very helpful for you to count the amount of salt and add this up to see whether you are in fact under this value. Diabetes. This needs to be well controlled, as diabetes is associated with a higher risk of atrial fibrillation. Good control of glucose has been associated with a reduced risk of atrial fibrillation. We measure this with a test called the hemoglobin A1C. This test basically measures what percentage of hemoglobin is bound with glucose. Hemoglobin typically lasts 3 months in the bloodstream, so we typically check this every 3 months in diabetic patients. Patients who have higher blood pressure readings have more glucose attached to the protein hemoglobin. A normal value is 6% and would indicate no diabetes. Hemoglobin numbers of 6 to 6.4% indicates prediabetes, and values above 6.5% indicate that the patient is diabetic. Optimal diabetic control is considered a number below 7%, but ideally I would say that the goal would be to get your hemoglobin A1C down into the normal range below 6 without diabetic medications. If you're a diabetic and you're successful at doing this, this would imply that you've reversed your diagnosis of diabetes. This can be done. A low carbohydrate diet can be very successful at reversing diabetes. Remember that carbohydrates are broken down in the intestines to glucose, and the less consumption you have of carbohydrates, the lower your blood glucose will be. The kind of diet that we're talking about for diabetics would be a 50 gram per day diet of carbohydrates. Exercise can help at burning carbohydrates as well. The next risk factor is stimulants. Avoiding stimulants is important at reducing the frequency of atrial fibrillation. These include caffeine, alcohol, recreational drugs, nasal decongestants, and some pharmaceutical medications. I recommend no more than 1 cup of coffee per day that's caffeinated. One, of course, can use decaf coffee, decaf tea, or decaffeinated other drinks. Alcohol should be avoided with no more than 1 drink per day. Binge drinking with alcohol, known as the holiday heart syndrome, is well known to precipitate episodes of atrial fibrillation. I've seen many patients over the years who have developed atrial fibrillation after a heavy night of drinking. Emotional stress. This can also trigger episodes. Adrenaline release with emotional stress is something that needs to be reduced. Good social supports with friends, family, and pets are very helpful. Mindfulness and meditation can be helpful at stress reduction. Structural heart disease. This is something that your physicians will help you with. It's important that all aspects of your heart disease is managed optimally. Atrial fibrillation is essentially associated with every kind of heart disease, including valve problems, coronary artery blockages, heart muscle problems, heart failure, or even other electrical system problems. Optimal treatment of all aspects of your heart will reduce the likelihood of you developing atrial fibrillation. Smoking. Quitting smoking is important, and this means cigars, cigarettes, marijuana, vaping, nicotine products, as well as other tobacco products. Keeping a diary of your atrial fibrillation. It's helpful to record information about your episodes, writing down the dates of when you had them, how long they lasted, symptoms that you had, heart rates while you're in atrial fibrillation using your blood pressure machine, and any treatment that you took. This gives you objective data to show yourself as well as your doctor how well your current treatments are going. You can easily see how frequent the episodes occur and for how long. It's very important to bring this in when you see your physician, along with other parameters which might include your blood pressure and pulse at other times, your weight, and any changes in your lifestyle that you have made. It makes it much easier for your doctor to be able to make decisions on how to manage your atrial fibrillation. Adherence to lifestyle modifications. You do need to remember that even when patients adhere closely to all of the above recommendations, atrial fibrillation episodes, while markedly reduced, are not completely prevented. There needs to be regular close follow-up with your own physician in regard to medications. It's important for regular review to manage this problem. In select cases, if medications are not helpful, an atrial fibrillation ablation may be warranted. I hope you've learned a lot about what you can do to prevent episodes of atrial fibrillation. If you like this video, consider subscribing and click the bell to receive notifications. I will be producing related content on a regular basis. Thank you for joining me on Medicine with Dr. Moran. I'm Dr. Keith Moran. Get healthy and stay healthy.